January 17, 1944. The night air was cold and heavy, the kind of quiet that only exists in a world on the edge of destruction. Inside a German military hospital tucked away in the heart of occupied France, the dim light of oil lamps flickered, casting long shadows against the sterile white walls. Nurses, exhausted from days of caring for the wounded, slept in makeshift beds, their faces hollow from the strain of war. The distant sound of artillery rumbled faintly in the background, a reminder of the relentless advance of Allied forces. But for now it was quiet. Without warning, the stillness shattered. A thunderous crash echoed through the hospital corridors as the door was forced open. American soldiers poured in, their faces set with grim determination. The nurses, startled from sleep, scrambled to their feet, wide-eyed and confused. The chaos that followed was overwhelming. The soldiers, desperate for medical help, were injured themselves, some barely clinging to life. The nurses, caught between their duty to their country and the lives before them, had no choice but to act. Forced to assist in surgery, their hands shook as they worked, not knowing if this would be the last time they'd wear the uniform they had sworn to. In this moment, they were no longer enemies. They were simply healers fighting for survival. By January 1944, the war had taken a decisive turn. The Allied forces, bolstered by the success of the D-Day landings in Normandy, were pushing steadily eastward, reclaiming lost ground and closing in on the heart of Nazi-occupied Europe. The Battle of the Bulge, fought in the winter of 1944-1945, would come soon, but in January the battle lines were in flux, with the Germans desperately trying to hold on to their territories as the Allies advanced. In the wake of the relentless Allied assault, the German military had been forced to adapt to the overwhelming pressure. As territories were liberated one by one, field hospitals, makeshift medical facilities, and even civilian clinics became vital to both sides. It was a time when the distinction between enemy and ally often blurred, especially in medical settings. Soldiers and civilians alike found themselves caught in a conflict that was no longer defined by uniforms alone. German nurses, who had been trained to serve their country, were often thrust into situations beyond their control. With the advancing tide of American forces, many of these medical personnel found themselves treating the very soldiers they had once considered their enemies. The chaos of war meant that the wounded and the dying no longer had any nationality. Their needs transcended borders. This hospital, located deep in occupied France, was one such place. A large, sprawling facility once used to care for German soldiers was now overtaken by the brutality of the war. The nurses had seen countless soldiers, both German and enemy combatants, rushed in from the front lines. But none of them could have expected what was about to happen. The American forces, determined to advance through the region, were closing in. The hospital was strategically important, a place where both sides would soon clash. The nurses, who had seen the horrors of war firsthand, were accustomed to the tension. But nothing could have prepared them for the moment when the American army would burst into their sanctuary, turning it into a battleground of its own. The situation was precarious for both sides. As the Allied forces pressed forward, the German military was struggling to maintain control over the occupied territories. The Western Front was a dangerous place in early 1944. Pockets of German resistance still held strong, but the Allies had regained momentum. American forces, including the 3rd and 4th Infantry Divisions, were advancing through the region, determined to push the German army back. For the American soldiers, time was critical. They had to move quickly and decisively to secure their positions and treat the wounded, especially given the brutal realities of battlefield medicine. The hospital, located in a strategic area, became a crucial point of care. But when the Americans arrived, the medical personnel they found inside were not what they expected. Instead of a field of enemy soldiers, they encountered a group of women, trained professionals, caught in a nightmare beyond their control. At this stage of the war, both the Allies and the Germans understood that the needs of the wounded transcended political and military lines. Medical personnel on both sides were aware of the grim reality: save as many lives as possible, regardless of the uniform they wore. But in moments of such tension, the lines of duty became blurred. The nurses, though sympathetic to the suffering of others, had little choice but to aid the soldiers, even as their own lives were held in the balance. The chaos that erupted inside the hospital was not just physical, but psychological. These nurses, most of whom had spent their days performing routine tasks and providing care, were thrust into the role of life-or-death decision-makers. Their every move, every decision, could mean the difference between life and death for both the men they had been sworn to care for and those who had come to take their country from them. It was a moment that would change the course of their lives, a brief yet intense chapter in the greater story of the war, a war that was testing the limits of human endurance, compassion, and survival. For the nurses caught in this moment of unexpected and brutal intrusion, the situation was one of deep internal conflict. These were women trained in the delicate art of care, tasked with healing, not harming. They had devoted themselves to the medical profession with the belief that they could make a difference in the suffering around them. But on that cold January night, as American soldiers burst into their sanctuary, their professional duty collided with a grim reality: survival. Most of these nurses were young, some barely in their 20s, living through a war that had stripped away the normalcy of life. They had witnessed horrific injuries, death, and the toll of a war that never seemed to end. But this intrusion was different. The soldiers before them were not faceless enemies. They were men, injured and in need of immediate care. And the nurses, though startled and frightened, understood that their duty was clear. They worked with the soldiers in silence, perhaps exchanging few words, but knowing that each movement, each action, could mean the difference between life and death. In their hands, the tools of their profession became instruments of salvation, even for the men who were, not long before, the enemies at the gates of their homeland. The emotional burden was heavy, yet the nurses did not falter. The professionalism instilled in them, the training and the ethics of wartime medicine carried them through. There was no time for hesitation. There was only the patient on the operating table, and the knowledge that, in that moment, saving a life was the only thing that mattered. From a tactical standpoint, the American forces were facing their own set of challenges. The invasion of German-held territory was fraught with danger. Every step forward was met with resistance, and the front lines were constantly shifting. The soldiers were fighting not only enemy forces, but also the brutal conditions of winter warfare, with limited supplies and constant pressure from the German military. The hospital, though now a neutral zone by necessity, was still strategically valuable. The Americans needed medical facilities to treat their wounded, and the German hospital, though occupied by their enemies, was still operational. The nurses, some of whom were experienced in treating battlefield injuries, found themselves caught between these opposing forces. The situation was tense as the Americans, in a desperate attempt to stabilize their troops, took control of the facility with little regard for the moral and ethical questions surrounding their actions. In this moment, the hospital became a microcosm of the larger war effort. The Americans were making gains, but they were also forced to make tough decisions. The human element of war, which often gets lost in tactical strategies, was evident here. The decision to use the hospital, to force the nurses into service, was a necessary one, but also one that illustrated the grim realities of war, where every decision could cost lives, and where the concept of medical neutrality could be disregarded for the sake of survival. The tools available to both German and American medical personnel were a stark reflection of the technological limitations of the time. In a world where resources were dwindling, every piece of medical equipment, every surgical instrument was a lifeline. The nurses, though skilled, often found themselves working with outdated or inadequate supplies. The facilities were stretched to their limits, and the chaos of wartime had left little room for preparation or planning. The nature of battlefield medicine in 1944 was brutal. Amputations were common, and the lack of antibiotics meant that infections were a constant threat. The nurses worked with whatever they had, improvising when necessary, but the grim reality was that many soldiers, both American and German, did not survive the battlefield wounds they suffered. Yet in this hospital, there was one crucial difference. The nurses had access to a level of care and expertise that many field hospitals lacked. Though working under immense pressure, the hospital's operating rooms were equipped with surgical tools and staff capable of treating severe injuries. The American soldiers, many of whom had been wounded in the advancing fighting, were brought here in hopes of surviving their injuries. But there was no escaping the brutality of the situation. Surgery under the best of conditions was difficult. Under the pressure of wartime chaos, it became even more grueling. Each operation was an act of desperation, each decision a gamble. And for the nurses, this was no longer about performing routine procedures. It was about saving lives, often in conditions that made the work feel almost impossible. The leadership on both sides played a pivotal role in the outcome of this chaotic situation. On the American side, the advancing soldiers were under the command of seasoned officers, trained to lead their men through the harsh conditions of the battlefield. However, the decisions they made in the hospital would ultimately shape the immediate fate of both the wounded and the medical personnel. For the Americans, the hospital was a vital asset. They could not afford to lose precious time in their advance, nor could they risk leaving their wounded soldiers untreated in the midst of such a critical phase of the war. American commanders, familiar with the desperate needs of the battlefield, understood that the nurses' expertise, though unwanted in a hostile environment, was essential. Orders were issued swiftly and decisively, compelling the nurses to assist in surgery. From the German side, leadership was equally important but far more complex. As American forces approached, German military leaders were faced with the difficult decision of how to defend key locations while keeping their medical facilities operational. The presence of the nurses and their need for protection added another layer of pressure to an already fragile situation. For these German officers, the idea of relinquishing control of the hospital to the enemy, even for the sake of saving lives, was an unbearable thought. In the end, the leadership decisions made in those moments determined the actions taken by the nurses. Both sides acted out of necessity. For the American officers, the focus was on securing the facility and saving as many lives as possible. For the German officers, it was a matter of accepting that survival, for both their soldiers and medical staff, required cooperation, albeit under duress. From the German perspective, the sudden intrusion of American forces was a brutal reminder of the fragility of their position. In January 1944, the Nazi regime was beginning to feel the full weight of Allied pressure. Germany's hold on occupied territories was steadily weakening. The front lines were in constant flux, and every battle could tip the scales in favor of the Allies. The German nurses, caught between their duty to their country and their commitment to the Hippocratic Oath, were torn. They had been trained to serve German soldiers, but their medical training transcended national boundaries. These women had witnessed the horrors of war and the suffering of countless wounded men. Yet in this moment, the enemy soldiers they were forced to help were no longer faceless adversaries. They were human beings in need of immediate care, and the moral implications of refusing them aid were clear. For the German soldiers who had been stationed at the hospital, the sight of their comrades aiding the Americans in their time of need was jarring. To them, it was a reminder of the crumbling of their defenses, both on the battlefield and in the moral fabric of the war. But in the midst of all this, there was also a strange sense of camaraderie. The battlefield blurred the lines between friend and foe. In this hospital, in the operating rooms, all that mattered was the preservation of life, no matter the uniform. The forced collaboration between the German nurses and the American soldiers raises profound ethical questions. Wartime medicine in its purest form is supposed to be neutral, an act of compassion that transcends national and political divides. But in this scenario, the nurses found themselves caught in an untenable position. They had a duty to save lives, yet those lives belonged to soldiers who were in many cases their enemies. The moral dilemma faced by the nurses was immense. Should they prioritize their loyalty to their country, or should they act according to the basic principles of medicine, saving lives regardless of the uniforms those lives wore? The situation was further complicated by the presence of the American soldiers. For the nurses, there was no escape from the reality that helping the enemy in such a direct, intimate way would have consequences, both personal and professional. And yet, the nurses did what they had always been trained to do. They worked tirelessly, using their skills and knowledge to stabilize and treat the wounded. In the end, the harsh truth was that survival came first. The act of healing, even in the most hostile of circumstances, was an act of defiance against the very nature of the war. It was a declaration that, no matter the political and ideological forces tearing the world apart, The human capacity for compassion remained unwavering. The American soldiers who stormed the hospital that night were not thinking of the moral weight of their actions. They were driven by a singular mission: to secure the facility, to treat their wounded, and to advance further into German-held territory. The hours leading up to their intrusion were marked by confusion and urgency as the front lines continued to shift. At precisely 3 a.m., the heavy thud of boots echoed through the corridors, reverberating against the cold stone walls. The American soldiers, tired and bloodied from battle, had arrived in force. They burst through the doors, taking control of the hospital in moments. Nurses were woken abruptly, many still disoriented from their sleep, and immediately thrust into a new kind of warfare, one that required their hands to heal the very men who had been their enemies only moments before. The order was clear: assist with surgery, and do so quickly. The Americans had suffered heavy casualties in the preceding hours, and every minute wasted could cost lives. The nurses had little time to process the invasion or their own emotions. Instead, they had to act. There were no questions asked. The soldiers, desperate and bloodied, were brought in, some already unconscious, others groaning in pain, their wounds severe. It was in these moments that the nurses were forced to set aside their personal feelings and do what they had been trained to do. The operating rooms, which had been used for German soldiers just hours before, became the scene of a frantic and grim fight for survival. They had no choice but to operate under duress, often with makeshift supplies and in conditions that were far from ideal. They had become unwilling participants in the American military's immediate need for medical assistance. The tension in the room was palpable. The nurses, though they had been trained for crises, were now working under pressure that none of them had anticipated. The operating tables became crowded with men from both sides of the war. The sound of bloodied bandages being torn and the sharp clink of surgical tools filled the air, as the nurses fought to save lives under the constant threat of imminent danger. The pivotal moment came when one of the American soldiers, gravely wounded, was wheeled into the operating room. The nurse who attended to him, her hands trembling, recognized that the injury was near fatal. A ruptured artery, the kind of wound that would typically require immediate and highly specialized treatment. The decision was made quickly: to perform surgery without the proper tools or anesthesia. In that operating room, the stakes could not have been higher. It was not just a matter of saving a life. It was a matter of making decisions in the heat of battle, under conditions where survival was uncertain. The American soldier lay motionless, trusting his fate in the hands of a nurse who had no personal stake in the outcome, other than the oath she had sworn to her profession. In those moments, there was no allegiance to one side or the other, only to the principles of medical care. With her hands shaking, the nurse worked tirelessly to save him, performing a risky operation under duress. It was an act of survival, not just for the soldier but for herself and for all who were involved in this chaotic, unforeseen situation. The soldiers watching from the door, some standing guard, others waiting in anxious silence, felt the weight of the moment. These nurses, who had been taken from their beds and thrust into a battlefield operating room, were the difference between life and death. When the surgery was completed successfully, there was no celebration, only exhaustion. The nurse, bloodied and drained, stepped away from the table, barely able to keep her composure. The soldier was still alive, but the cost of this act of compassion was evident on her face. It was then that the realization hit: there would be no easy victory in this war. No one, neither the nurses nor the soldiers, could escape the brutality of what had become an endless fight for survival. The hospital had not just become a place of healing. It had transformed into a symbol of the war's moral complexities. Here in this room, the human spirit had clashed with the horror of war in a way that no one could have predicted. The immediate aftermath of the American intrusion into the German hospital was marked by both physical and emotional exhaustion. The nurses, though they had performed their duties under immense pressure, were left to grapple with the profound psychological toll of the experience. Having saved lives, many of them American, at the cost of their own peace of mind, they found themselves caught in the aftermath of a battle that was not their own. The American soldiers who had been treated in the hospital were swiftly evacuated, their injuries ranging from superficial wounds to life-threatening trauma. Despite the high number of casualties, The hospital's staff had managed to stabilize many of them, preventing the loss of more lives. In the short term, the hospital was no longer a German military asset. It had been overtaken by American forces, who established their own medical operations within the facility. The German nurses, once loyal to their country, found themselves in a strange new reality, still serving as caregivers, but now under the direction of the enemy they had been taught to despise. For the American forces, the hospital represented a strategic victory. It was a necessary stop on their march eastward, providing a much-needed medical station where they could treat the wounded soldiers and regroup before continuing their advance. Yet, while the tactical value of the hospital was undeniable, the moral complexities of the situation hung heavily over the operation. The nurses had been coerced into providing assistance, yet their skill and expertise had proven invaluable. The Allies, in their haste to push through the territory, had been forced to reckon with the humanity of the women who worked tirelessly to save lives, regardless of whose uniform those lives wore. For the German soldiers, the loss of the hospital to the American forces was symbolic of a larger, more distressing truth. Their hold on occupied territories was weakening. The psychological impact of losing such a crucial medical facility was profound. The hospital, a symbol of German strength and self-sufficiency, had been turned into a temporary refuge for the enemy. It was another indication that the Allies were not just advancing in numbers, but were taking control of the very spaces that had once been considered invulnerable. In the longer term, the repercussions of this event were felt far beyond the walls of the hospital. The nurses, caught between their duties to their patients and their country, were forever changed by their experiences. While some continued to serve in their roles as medical professionals after the war, others left the field entirely, unable to reconcile the trauma they had witnessed. The forced cooperation with the enemy, the moral dilemmas they had faced, and the overwhelming toll of war had left deep scars on them. For the American soldiers, the experience was similarly complex. Many would later recall the surprising professionalism and dedication of the German nurses who had, under duress, assisted them in their most vulnerable moments. Some soldiers, having experienced both the brutality of war and the unexpected compassion of their enemies, found themselves reconsidering their views on the people they had been fighting. The nurses' actions that night, though dictated by circumstance, became emblematic of a larger truth, that war, for all its dehumanizing effects, could still reveal moments of profound humanity. The hospital, once a symbol of German medical prowess, would never be the same. The invasion had transformed it from a place of healing for German soldiers to a neutral zone where the realities of war became impossible to ignore. Both sides had crossed moral boundaries, but in doing so, they had inadvertently demonstrated the power of survival, compassion, and professionalism in the face of overwhelming odds. As the war raged on, both the Allies and the Germans would continue their respective advances. But the memory of the hospital, of the nurses who were forced to perform surgery on soldiers they had once considered their enemies, lingered in the minds of those involved. It was a reminder that in war, the line between right and wrong is often drawn in shades of gray. The events at that hospital, though they may seem like a small chapter in the vast and tragic story of World War II, serve as a poignant reminder of the complexities of human nature in times of conflict. The nurses, who were thrust into a situation beyond their control, demonstrated the enduring power of compassion even in the face of overwhelming adversity. They were not just medical professionals. They were human beings, caught between their allegiance to their country and their obligation to the sanctity of life. In war, moral boundaries often blur. The notion of neutrality, so deeply ingrained in the medical profession, is stripped away when survival becomes the only priority. The nurses, forced to treat the very soldiers they had once considered enemies, embodied this tragic paradox. They were compelled to act with compassion, not out of loyalty to one side or the other, but because the human instinct to save lives transcended everything else. What happened in that hospital was not just a matter of strategic importance for the American army or a loss for the German forces. It was a moment that highlighted the fragility of humanity in the face of war. These nurses, despite the chaos and moral dilemmas, chose to preserve life. They found a way to maintain their humanity even when the world around them had descended into madness. The story of this hospital is not one of victory or defeat, but of the quiet resilience of those caught in the middle of a war that demanded so much more than they could ever give. It is a reminder that even in the darkest moments of human history, acts of compassion and courage continue to emerge, often from the most unexpected sources. And in these moments, we are reminded that, in the end, it is not the uniforms we wear that define us, but the choices we make when confronted with the hardest truths of our shared humanity.